much. Good to see you. Good to see you. Thanks for everything.
We're keeping well, but it's coming closer to the end. It's scary.
The chairman of the Diabetic Foundation, executive members, civil society organizations, Ministry of Health representatives, ladies and gentlemen, good evening. I'm delighted to be here with you, and I thought I was trying to put my thoughts together about an hour ago, and what I did was I thought I'd give it a historical background and look at the problems on hand. We all know about the NCD issues, non-communicable issues, which exist globally and in the region. And seriously, let's talk about Fiji. Now, amongst the NCD issues which arise includes diabetes, hypertension, mental health diseases, and it's important to focus on diabetes today. Now, I take you back in time, and that in the 1960s, Professor Zimmert, a well-renowned diabetologist from Melbourne, along with our very honored physician, Dr. Parshuram, undertook studies in Fiji. And the incidence of diabetes at that stage was 0.4% in the Itoke population, whilst it was noted to be about 8% in the Indo-Fijian community. What has happened? In the 90s, the figures went up, and that we had created, this diabetes has created a level field, so that the incidence went up to 16%, and that was demonstrated in the first WHO STEP survey. But what is it showing now? Apart from the genetics and apart from the environment factor, we are now closing in to 30% diabetes in Fiji. So if you look right to you, whoever's sitting on your right, do that. And look at the person on your left. So amongst the three of you, one is pre-diabetic or diabetic. That's how bad the problem is. Now, what have we done? What have we done in the last 6 years? The government is totally committed to arresting, as rightly stated, and then reversing. This is nothing which we can sort out tomorrow. It will take possibly 1 or 2 generations to reverse. We have established 3 hubs now at the divisions. These hubs serve to provide diabetic care, but 2 days a week, anybody off the street can come in and be screened at no cost for diabetes. This is a wonderful concept, and it has taken a while because the 3 divisions were acting in different manners. Somebody was going clockwise, the others were going anti-clockwise, so really we had to halt and then move ahead. And I think now we are moving in the right direction. So we have hubs. These hubs now need to develop, go down to the subdivisional level and then down to the community level. We are grateful for the International Diabetic Federation to bring in foot care into Fiji and to be able to address the issue of diabetic angels. So we know that there's going to be 40 nurses from the 20 subdivisional hospitals to be able to address adequate care of feet. But that's one part of the equation. The primary problem is we're running around without footwear. And of course, when you have diabetes, if you run around without footwear, you will end up with infection in your feet. And you will end up with, and if you leave it to the surgeons, then you'll end up with amputations. So we need paradigm thinking and change. We've got to move diabetes into the area of the physician. And Dr. Shish Acharya, please note that. Now, we have also, for the first time in Fiji, got a foot prosthetic unit. So now, nobody should be maimed, bound to a wheelchair. If we can get them right, we can get artificial limbs done, and their productivity as individuals will increase. And this Foot Care Prosthetic Center provides all Fijians a free service. So I am concerned that not all of them are using this service. Then we are grateful for Rotary. Rotary International brought in the facilities to set up a cardiac cath unit, because diabetes and heart disease go hand in hand. One leads to the other. One way around, is it? Then you have eye problems. Eye problems, we have full facilities now, thanks to Fred Holler Foundation of New Zealand, for laser treatment of eye diseases. And we have a beautiful eye center in Suva, in Lotoka, in Lambasa, where laser is available to prevent the complications of diabetes. Ladies and gentlemen, if I have to say something, and if there is a bottom line message this evening, it is that you can live with diabetes if you are adequately cared for. If you develop the complications of diabetes, whether it is ocular disease, eye disease, heart disease, kidney disease, or complications as a result of foot infections, then these are the stumbling blocks and which will adversely affect your quality of life. We have also prospected the development of dialysis. And there's so many patients with end-stage kidney failure. Patients who deny the fact that they have got diabetes. And when they end up with end-stage kidney disease, then they said, why is the government not providing dialysis? When there's physical limitations in a developing country, dialysis may not be possible long term. But we are working on this. The Diabetic Kidney Foundation of Fiji, the Zen Ming Lo Clinic in Nandi, we are now working with other organizations to bring in dialysis at reasonable costs. The costs need to be contained. And the government is working tirelessly in this area to be able to bring in dialysis for people with kidney disease as a result of diabetes. We are also in the final stages of vetting our kidney transplant laws. When you have end-stage kidney disease, one option is to go on chronic dialysis, the others to go on to kidney transplants. Currently, patients are traveling all the way to India for care, and along with the a support person or somebody who can donate a kidney, and it's costing them close to between $35,000 to $50,000 Fijian to get a kidney transplant. As our facilities develop, by the end of this year, we will have 13 operating theaters at CWN. And when we have that full capacity, then I'm confident that we will be able to undertake kidney transplants in Fiji, so that we are assisting our patients to a certain degree. But that doesn't end there. We need people like Dr. Rajesh Sharma, who's been trained additionally in developing a database on diabetes. And along with the team at the Diabetic Center and under the guidance of Dr. Wahid Khan, I'm confident that we will have a lot more clear data on diabetes in Fiji, so that that's hard evidence for us to be able to make hard decisions. We are grateful that we will be undertaking a trial on pen insulin, and that shortly this study will help us determine how we should be able to offer insulin to our patients who need it with type 1, and especially the ones who are complicated and we cannot manage on medication alone. So, ladies and gentlemen, there's a whole host of things happening here. And we are grateful to the Australian government through AusAid and FHSSP, the Israeli government for consumables, the International Diabetic Federation for all the support with the Diabetic Angels Project, the government of India for support, Rotary International, the Fred Howler Foundation, Kidney Foundation, Ken Ming Lo, Zen Ming Lo, and the Republic of Taiwan for training purposes. Now, what do we need to think about? What do we seriously need to think about is how our advocacy programs, our screening programs, our treatment and follow-up programs will run. My concern is the denial of our common citizenry. The denial that they've got diabetes. When they have an elevated sugar level and it's confirmed that they are pre-diabetic or diabetic, then people opt for herbal treatment, alternative treatment, but they do not appreciate the fact that sometimes you need medication along with whatever else you're doing. So this is something which needs to be worked on, sort of tirelessly by all of us. The social determinants of health makes a great impact on how we spend our money in health. Where you're born, how you're educated, what you eat, how you live your life, how much alcohol you drink, how much food you consume, how much calories you intake, how much processed food you eat, all of that matters. So really, it's time for us to rethink, re-strategize, and see how we can alter the social determinants of health so that we can use our money appropriately in healthcare. My concern is the high incidence of diabetic amputations. And that is an issue which we need to pursue with great austerity, great thought, great decision making. And I think it's time that we rethink how amputations are required. And as I've said previously, that we need to understand why people run around barefoot and not look after their feet. We need to rethink our consumable supplies in diabetes. We need to rethink greater use of insulin. Sometimes, because of the international pressures, the cost of machines has come down. The glucometer is costing under $20 now. But the strips are so expensive, and we are negotiating with the international partners as to how we can bring some of those costs to make it possible for every diabetic to have some sort of access. How possibly we can work in with the community to get a lot more blood tests done, so that people don't say, well, I'm feeling well today, so my sugar's good, so I don't need to test myself. That's on the other extreme, as a young lady talked about her issues, that all she had was a test once a month, and that was inappropriate too. So, ladies and gentlemen, what I'd like to do is to conclude by saying that the pillars of development lies with health and education. How we look after ourselves, how we grow and develop. The socio-economic development of a country leads, if you are successful at your health and education, and you're socially and economically developed, then only national development will move forward. So it's important that we all work together. And I cannot understate the involvement of the private sector, the corporate social responsibility which we need to put together to make diabetes less of a problem for our people. So I would like to congratulate the Diabetic Foundation and my colleague Dr. Wahid Khan and his executives for undertaking a mammoth task, supporting the Ministry of Health, and I am confident that the support Diabetic Federation will receive, or Foundation will receive, from the Consumer Council and the other partners to make sure that soft drinks are not used as widely as it is now. Tell me, which other animal in this world drinks soft drinks? I haven't seen any gorilla, any lion, any elephant asking for Coke or Pepsi. They all drink water. So why are we so different? Thank you very much.
Incidentally, the Minister of Health is also the patron of Diabetes Fiji, and the plaque basically said that Diabetes Fiji was officially launched by the Honourable Minister of Health and patron of Diabetes Fiji, Dr. Neil Sharma.